This is the sixth video in the series Quality Improvement Workshop, in which we will talk about 4 quality tools: flowchart, histogram, scatter diagram, and Pareto diagram. In the rare workshop, we usually divide trainees into groups that perform hands-on exercises on these tools. For more videos, visit my Facebook page, Healthcare Quality. The first tool is flowchart, which is a graphic representation of the sequence of steps in a given process. They provide a common understanding of a process and allow identification of problems. They must accurately describe the process and has application in all phases of problem solving. The following are 7 symbols commonly used in flowcharts. Flowcharts may be high-level or detailed. A high-level flowchart shows where a process begins and ends, and also plots the major steps. They have no rework loops, minimum complexity, and are useful in early phases of projects. They also help confirm that the project team has participation from the appropriate departments for the problem at hand. In this example, for emergency department triage process, the patient enters ER area, then give name to registered nurse, and history and physical, then disposition of patient and registration, and lastly the patient enters ER room. By agreeing on a high-level flow diagram early in the project, team members establish a common understanding of the process they are investigating, its beginning, end, and the series of steps that constitute the workflow. Each of these steps will be described in greater detail later on in the diagnostic journey. Detailed flow charts, on the other hand, consist of dozens of steps. They show rework loops and complexity. They are useful in later phases of projects after pinpointing issues in the process or when making changes. This is the same process, ER triage, with more details. When the patient enters ER area and gives his name to registered nurse, she checks. If he is acutely ill, she refers him directly to ER room. If not, she refers him for history and physical. Then they check if he belongs to any health maintenance organization. They refer him to the liaison to review his case. Then they dispose the patient and register him, and finally refer him to the ER room. Returning to our example, for instance, team members may later diagram the steps involved to find a bed for the patient, For now, however, this greater level of detail is not required. Here is another example. This detailed flow chart describes the process for admitting patients from a hospital's emergency room to its nursing units. The process begins when the ER physician decides to admit a patient. Next, the physician writes an order. The ER clerk calls the admitting department, and admitting in turn find an appropriate nursing unit with an available bed. Then a nurse from the unit calls the ER nurse for nursing orders for the new patient. After the nurse-to-nurse communication, an admission may follow one of two paths. In special cases, the patient is transported to the nursing unit by an ER nurse and an assistant. In other cases, the ER clerk calls transport, which sends someone to transport the patient to the nursing unit. These flow diagrams boundaries exclude from the project any delays preceding the ER physician's decision, those associated with lab tests or consultations with the patient's personal physician, for example. It also excludes possible delays once the patient reaches the nursing unit. These other possible delays may be addressed at other time, but they are not part of this project. Note that at 3 steps in the process, documents are created that may be useful source of data for the team. Now we come to the next quality tool, which is histogram. It's a graphic summary of variation in a set of data. Values in a set of data almost always show variation. This variation displays a pattern. Patterns of variation are difficult to see in simple tables of numbers. Patterns of variation are easier to see when the data are summarized pictorially in a histogram. In a histogram, we plot data in a frequency distribution table in a graphical form. The histogram shape shows the nature of distribution of these data. How to construct a histogram? 1. Obtain the table of raw data and determine the high value, low value, and range. Range equals high value minus low value. Step 2. Decide on the number of cells. Use the following guide. Step 3. Calculate the approximate cell width. Approximate cell width equals range divided by the number of cells. Step 4. Round the cell width to a convenient number. Make the cell widths 1, 2 or 5, 0.1, 0.2 or 0.5, 20 or 50, etc. Step 5. Construct the cells by listing the cell boundaries. The first cell should include the lowest data value. Be sure that the classes are mutually exclusive so that each data point will fit into one and only one class. Tally the number of data points in each cell. Check that total tally marks equal number of data points. Step 7. Draw and label the horizontal axis. Go one cell width beyond the lowest and highest cell. Provide numeric labels and a caption to describe the measurement and its units. Step 8. Draw and label the vertical axis. Label the axis from 0 to a multiple of 5 that's greater than the largest tally in any cell. Provide a caption of number or percent. Step 9. Draw in the bars to represent the number of data points in each cell. The highest of the bars should be equal to the number of data points in that cell as measured on the vertical axis. Step 10. Title the chart, indicate the total number of data points, and show nominal values and limits. Step 11. Identify and classify the pattern of variation. Step 12 and final step. Develop a plausible and relevant explanation for the pattern. Use your team's knowledge and observation. Confirm your theories through additional analysis. Common patterns of variation are: bell-shaped is a normal natural distribution of data from a process. Double-peaked suggests that two distinct processes are at work. Possible different processes include different times of day, different days of week, different levels of case activity, or census in hospital. Plateau indicates too many processes. Comb-shaped typically indicates data errors. Skewed typically occurs when a particular limit or a specification limit exists on one side. Edge-peaked occurs when the extended tail of the smooth distribution has been cut off and lumped into a single category at the edge of the range of the data. For example, data bigger than that, or data less than that. Now we come to the next quality tool, scatter diagrams. It uses dots to show the relationship between two factors or two variables. They can be used to test theories and identify root causes, and in designing remedies and holding the gains. How to construct a scatter diagram? Obtain the table of raw bird data and determine the high and low values for each variable. Decide which variable will be plotted on the horizontal axis and the vertical axis. Usually independent variable on x-axis and the dependent variable on y-axis. Draw and label the horizontal and the vertical axis. Make the axes roughly the same length, creating a square plotting area. Label the axis in about 6 conventional multiples of 1, 2, or 5. Make the lowest label slightly less than the lowest value, and the highest label slightly greater than the highest value for each variable. The data should fill the plotting area. Label increasing values from bottom to top on the vertical axis and left to right on the horizontal axis. Provide a caption to describe the measurement and its units. Plot the bird data. Use concentric circles to indicate identical bird data points. Title the chart and provide other appropriate notations. Identify and classify the pattern of correlation. Scatter diagram findings. Strong positive correlation. The value of y increases as the value of x increases. Strong negative correlation. The value of y clearly decreases as the value of x increases. Weak positive correlation. The value of y increases somewhat as the value of x increases. Weak negative correlation. The value of y decreases somewhat as the value of x increases. No correlation. For any value of x, y can have both large and small values. There does not appear to be any particular relationship between x and y. Look for other variables that influence y. Now we come to the quality tool Pareto diagram. A Pareto diagram displays the relative impact each contributing factor has on the overall problem. It ranks the sources from largest to smallest and shows the total cumulative impact for the 2 largest, 3 largest, etc. What questions the Pareto chart answers? What are the largest issues facing our team or business? 80-20 rule. What 20% of sources are causing 80% of the problems? Where should we focus our efforts to achieve the greatest improvements? Some typical classifications that lead to finding the vital few include type of defect, time of day, week, month, or year, sequence, the first, second, third, etc., type of activity or product, Characteristics of groups or individuals doing the work. Characteristics of patients or other customers. Place where the work is done. Here is a sample Pareto chart for rejections due to incomplete application forms. When we plot the different causes of the problem, we found that no signature represents 80% of these causes. In a second example, an analysis of the East Bahamas State University admissions area suggests that there is a problem with employee tardiness. Data were collected regarding reasons for tardiness, and 168 cases of tardiness were documented. What reasons do you think were given by employees for their tardiness? When we look to this Pareto chart representing the different causes of employee tardiness, we found that traffic, childcare, and public transportation represent about 80% of the causes of this problem. Sometimes a Pareto diagram does not produce a clear picture of the vital few because each of the categories is nearly equal in importance. When this happens, it doesn't mean that the Pareto principle doesn't apply to the problem. If the team will try some other way of classifying the problem, they will almost certainly find at least one classification that will produce a vital few. In this example, we were studying the problem of rise of temperature in chronic renal failure patients on hemodialysis in Portside General Hospital hemodialysis unit. Studying the environment by comparing results in different rooms, we found no significant difference in this Pareto diagram. No vital few cases could be detected. Comparing patient data according to the responsible nurse show also that the curve of the cumulative percent of total goes steeply, and so we cannot define vital few nurses responsible for the majority of cases of increased temperature. Comparing data between daily shifts of dialysis, the first shift, the second shift, and the third shift, we found that the first shift of dialysis contribute to more than 60% of cases of high temperature alone. By further study of the difference between shifts, we found that the first shift usually begins at 5 a.m. and doctor's duty start at 7 a.m. So patients are left 2 hours without doctor's supervision. We worked on adjusting doctor's start duty times. Thank you.